Hi, my name is Leanna Farmer, and I'm doing mineral deficiencies in cage layer hens. High-producing laying hens maintained in a cage sometimes show paralysis during and just after the period of peak egg production, due to fracture of the vertebrae that subsequently affects the spinal cord. The fracture is caused by an impaired calcium flux, related to a high output of calcium in the shell. Layers are capable of early egg production, exceeding 95% for at least 6 months, which place even more pressure on the maintenance of accurate calcium flux between the diet, the skeleton, and the oval duct. As the hens age, mallard bones is replaced on a daily basis as the demands for calcium diminishes greatly. Immediately after oviposition and before the start of shell classification of the next egg, however, sculptures corotactile and tubular bone is not replaced while the hen is producing. Over time, the mallard bone, which initially forms a protection layer over the sculpture bone, becomes more diffused in the mallard cavity. Affected birds are invertebrate, found on their sides in the back of the cage at the time of the initial paralysis. Birds appear healthy and often have shelled eggs in oviduct and an active ovary. Death occurs from starvation or dehydration because the birds simply cannot reach feed or water. Affected birds can recover if moved to the floor. A high incidence of cage layer fatigue can be prevented by assuring the normal weight for age of pullets at sexual maturity, and by giving pullets a high calcium diet, minimum 4% calcium for at least 7 days before oviposition. Older cage layers are also susceptible to bone breakage during removal from the cage and transported to processing. Bone strength cannot particularly be improved during the production cycle without adverse consequences to the other economically important traits such as eggshell quality. Cage layer fatigue is undoubtedly related to high sustained egg output, and as associated clutch lengths of 200 to 230 eggs laid on a successful day. Diets must be provided adequately quantities of calcium and phosphorus to prevent deficiencies. However, feeding diets that contain 2.5% calcium during the immature growing period, 16 weeks produce a high incidence of neurophysis, vascular gout, calcium urate deposit in the uterus, and sometimes high mortality, especially in the presence of infection and bronchitis virus. Eggshell strength can be maintained, and the inevitable loss of bone strength can be mitigated by feeding 65% to 70% of the dietary calcium supplement in the form of coarse limestone, 2 to 4 millimeters in diameter, with the remainder as fine particles limestone, offering the coarse material to be retained in the gizzard, where the calcium can be absorbed. continually and especially at night when the bird is not feeding and when peak demand for shell classification occurs. By the severity of the condition and the portation of the flock. Now I'm going to move on to vitamin deficiencies in poultry. Vitamin deficiencies are most commonly due to inadvertent omission of a complete vitamin premix for the bird's diet. Multiple signs are therefore seen, although in the general sign of B vitamin deficiency appear first because there are some stored of fat-soluble vitamins in the body. It often takes longer for these deficiencies to affect the bird, and it may take months for vitamin A deficiency to affect the adult birds. Treatment. A prevention relies on an accurate dietary supply, usually micron capsules, in a gelatin or starch, along with an antioxidant. Vitamin destructions in feeds is a factor of time, temperature, and humidity. For most feed, efficiency of vitamins is little stored within mixed feeds, or a little storage within mixed feeds. Moving on to vitamin A deficiency. Depending on the liver stores adult birds could be fed a vitamin A deficiency diet 2 to 5 months before any signs of deficiency develop. Eventually, birds become emaciated and weak with ruffled feathers. Egg production drops markedly. Hatchable decrease and embryonic mortality increase. As eggs production declines, there will likely be only small fecals in the ovary, some which show signs of hemorrhage and watery discharge, for the eyes may also be noted. As the deficiency continues, milky white cheesy material accumulates in the eye, making it impossible for the birds to see. In many cases, the eye may be destroyed. The first lesion, usually noted in adult birds, is the mucus gland of the upper alimentary tract. The normal epithelium is replaced by a stratophyllum squamous, and layer. This blocks the duct of the mucus gland, resulting in neurotic secretion. Small white pastules may be found in the nasal passage, mouth, esophagus, and the pharynx, and these may extend into the croup. Breakdown of the mucous membrane usually allows pathologic microorganisms to invade these tissues and cause secondary infections. Depending on the quality of vitamin A deficiency, diet may show signs of a deficiency for up to 7 weeks. Growth signs in chicks include anoronics, emaciation, and ruffled feathers. If the deficiency is severe, the chick may become atoxic, which is also seen with vitamin E deficiency. The yellow pigment in the shanks and the beaks is usually lost, and the comb and wattles are pale. A cheesy material may be noted in the eyes, but exfolium is seldom seen because chicks usually die before the eyes become affected. Secondary infection may play a role in many of the deaths noted with acute vitamin A deficiency. Young chicks with chronic vitamin A deficiency may also develop pastules in the mucous membrane of the esophagus. That usually affects the respiratory tract. Kidneys may be pale and the tubulars distant because of uric acid deposits. In extreme case, the uterus may be plugged with uterites. Blood levels of the uric acid can rise from a normal of 5 milligrams to as high as 40 milligrams to 100 milliliters. Vitamin A deficiency does not interfere with uric acid metabolism, but does prevent normal extraction of uric acid from the kidneys. Histologic findings include atrophy of the cytoplasm and loss of the cilia in the columnar clytic epithelium. Although vitamin A deficiency chicks can be atoxic similar to those with vitamin E deficiency, no gross lesions are found in the brain of a vitamin A deficiency chicks as compared with degeneration of the Purkinje cells in the cerebellum of vitamin E deficiency chicks. The livers of atoxic vitamin A deficiencies. Chicks contain little or no vitamin A because stable vitamin A supplements are mostly universal used in poultry diets. It is unlikely that a deficiency will be encountered. However, if a deficiency does develop because of either inadvertent omission of the vitamin, a supplement or the inadequate food preparation up to 2 times the normal recommend level should be fed for 2 weeks. Vitamin A can be administered through the drinking water, and such treatments usually result in faster recovery than supplementation via the food.